Nicholas Walter, CEO, Billings Clinic.
All right. A big day in Missoula. I know that there's been a lot of talk, a lot of excitement about the sale being finalized from Community Medical Center. So today was the big day, right?
Well, it certainly is, and we are enthused. I think that opportunities working with our partner Regional Care and then partnering with Community to look at service line growth. How can we really focus on quality and safety of care? How do we deal with all the issues related to health reform? We're excited about the potential that this partnership has to really serve the residents of Missoula and the surrounding area well.
Now, Dr. Walter, what specifically does this partnership bring to Missoula that perhaps we didn't have before?
Well, I think that one of the things that intrigued Billings Clinic about a partnership with Regional Care was they've got a long history of hospital management experience. They have access to capital. In Billings Clinic, we're formed by a merger of Deaconess Medical Center and Billings Clinic back in 1993. So we bring a lot of experience in terms of how physicians work well with hospitals, how do you develop physician leadership, working closely with hospitals. We've had a lot of focus on quality and safety and have been part of some of the Medicare demonstration projects. So we think that combination does bring some resources into Community, into Missoula, that will create benefit.
All right. Now, I was going to ask you about the if you will, the foundational arm of Community that is being funded through the sale. Have the proceeds of that has it been determined yet where those might be going?
Yeah, and I don't really have any knowledge on the proceeds. As part of a joint venture that did the acquisition, we really haven't been part of any of the conversations about how the proceeds would be used.
Okay. Well, let's talk for a second about this. There have been some concerns in Missoula, and I'm sure you probably read them and have visited with folks about them, about the transference from Community Medical Center being a non-profit hospital, moving to a for-profit type philosophy. And some folks are a little nervous about that. Is there anything that you can say to help ameliorate that concern?
Yeah, I think the first thing I would say is those who've raised concerns and questions and have been worried about it, they've put very good questions on the table. And I think that from our point of view, we want to be sure that appropriate charity care ratios are maintained. We want to be sure that we try to keep as many jobs in Missoula as possible rather than having those be transferred to some other location. And I think our focus on trying to provide the best care and the best experience will continue. Community's done excellent work in recent years. I have gotten comfortable with this, and I've noticed that elsewhere in the country, there are not-for-profits like Billings Clinic partnering with for-profit hospital companies like Regional Care. For example, Cleveland Clinic is doing a similar partnership with a large organization. I believe it's Community Health Systems. So people are starting to look at how their various attributes might create partnerships like this that ultimately can be beneficial to places like Community Medical Center.
So what's the next step? Is obviously all the business transactions have been completed. So what's the next step in this partnership, Doctor?
Well, an interim CEO named Jeff Egbert was on site today. He will become the interim, and the plan is that he would be there. And I can't give you an exact time frame, but let's just say 6 or 7 months, so that we have good stability with the transition. He will spend time listening to staff, listening to the senior management team, and working with both Regional Care and Billings Clinic as we put together some strategy and tactics about what are the areas of service line development. We'll want to put together a physician recruitment plan. So many things that we have to work on. So the next steps really are more analytics and then creating kind of a strategy and tactics that we think will be good for the area.
Now, one final question, and that is obviously Providence St. Patrick Hospital is right across town. Or have you had a chance to reach out to the management there to find out how you folks can cooperate to make health care better for everybody in Missoula?
Well, I haven't personally had a chance yet, although I would really like to meet with them. And I'll just say that in Billings Clinic and St. Vincent Healthcare, we're competitors. Our facilities are only 2 blocks apart. But we have found ways to both be competitors, but then find common ground where we could work together on things like community health planning, medication assistance for low-income people, a crisis center for people with drug and alcohol issues. And so I think it's possible to be competitors, which in some ways can be beneficial to a community, but it's also possible to find really good areas where you can work together, and that would be our goal.